Hi, I'm Dr. Sangeeta Almadi and I'm going to talk to you today about pigmentation. Pigmentation or hyperpigmentation is a term that we use to describe dark spots or patches or even general darkening of the skin. In the upper layers of the skin, we have certain cells which are pigment cells and are called melanocytes, and these produce a certain pigment called melanin. This is evenly distributed in the skin and gives all of us the color that we normally possess. We can get darkening of the skin due to many factors, both external and internal, at any time in our lives. The most common external cause of pigmentation is ultraviolet radiation or sunlight, and one of the commonest internal causes is hormones, especially in women. Any of these factors can increase the pigment cells in the skin or actually activate the cells to produce more melanin. There are many common types of pigmentation: freckles, age spots, melasma, post-inflammatory hyperpigmentation, etc. These often cause a cosmetic problem and hence require treatment. Freckles are a typical common response to sunlight, and you can see them as light brown spots on the face and exposed parts of the body. They're often seen in fair-skinned individuals and from very young ages. They can be effectively prevented by good sunscreening habits. Age spots, also called lentigines, are darker spots, and these are often seen as we grow older after the ages of 40. Melasma is a kind of pigment which shows up most commonly on the cheeks in the form of brownish or greyish-brown patches, which are sharply defined. They can also come up on the forehead and on the chin. Two main factors causing melasma are sunlight and hormones, and it is more common in women. Very often, melasma appears either during or post-pregnancy. Often we find pigmentation being left behind after we develop boils or other infections, eczemas, other allergies, injuries, etc. on the skin, and this is something that we call post-inflammatory hyperpigmentation. It gets left behind because there is some inflammation in that part of the skin. There are certain cosmetics, perfumes and other allergens which can on their own leave dark patches on the skin, and we call this pigmented contact dermatitis. Another common cause of patchy pigmentation is aging itself, and this is because of the effect of ultraviolet radiation or sunlight on the skin. We often see that beginning with unevenness of tone, a little bit of patchy dark spots, and an alteration in texture, so the skin gets a bit rougher. This we can prevent to a large extent through good sunscreening habits, which we should adopt at a very young age in life. Last but not the least, dark circles, those dark patches that we see below our eyes. Very often they're familial, but different factors such as age itself, stresses, allergies, dry skin can aggravate the appearance. The problem with dark circles is that they make us look dull and tired. If you suffer from pigmentation, then you should be looking for a comprehensive and holistic solution to this problem. There are many different kinds of products, topically prescribed medications, and chemical peels, which when combined together can help us get rid of your superficial pigmentation. Ideally, this should be customized for you by your dermatologist after a detailed evaluation of your specific skin concern, and then deciding the best possible way to address it. If we need something deeper, then there's a specific laser called the Q-switch Nd:YAG laser, which is very safe and effective and specifically targets the melanin in the skin without affecting the neighboring areas and leaves your skin clear and flawless. The first mantra to really good skincare is to protect your skin using a sunscreen. You can use a sunscreen of SPF 15 to 30, could be even higher. However, what is more important is how you apply it. A sunscreen needs to be applied in a thin film across the face and the exposed areas of the body, and then left on for 15 to 20 minutes so that it can settle in. If you tend to sweat a lot, you may need to reapply this every 2 to 4 hours. And of course, you should apply a sunscreen even if you're indoors, because the ultraviolet radiation or even the visible light, which is indoors, can also affect your skin and cause pigmentation. A good cleansing regime is very important to keep your skin clean. Choose a cleanser which is formulated for your skin type: dry, oily or normal. You can use this twice or thrice daily. If your skin is oily, you can add a toner for deeper cleansing. After cleansing your skin, you need to hydrate, and this can be done using a moisturizer. In the daytime, your sunscreen itself can be this moisturizer. At night, you can use a night cream containing vitamin C, and this will also help to keep your pigmentation at bay. A balanced diet, good sleep, and adequate exercise is very important in keeping your skin healthy. Incorporate foods in your diet which are rich in vitamin C and sun-protecting agents like beta-carotenes and antioxidants. For example, red and orange fruits and foods like carrots, tomatoes, peppers, and other vegetables such as cauliflower, broccoli, spinach, greens, etc., and omega-rich foods such as fish and shellfish. And above all, relax, de-stress, fill your lives with positive energy.